In March 2018, Worcestershire had a local area SEND inspection. This was undertaken jointly by Ofsted and the Care Quality Commission. The inspection raised significant concerns about the effectiveness of the local area. The local area was required to submit a written statement of action to Ofsted to detail how significant areas of significant weakness could be addressed. 12 key areas were identified and are known as the 12 key concerns. These are being actioned in the SEND Improvement Programme, a multi-agency programme involving SEND services, social care, health and education providers. The key concerns have been split over multiple work streams to break the work into manageable pieces. The SEND Improvement Programme reports every other month to the SEND Improvement Board, and 3 times a year advisors from the Department for Education and NHS England are present. The advisors feed back on the progress so far, identify areas where more focus is needed, and give general advice on the programme of work to ensure we are addressing the key concerns. Since 2018, we have undertaken a huge amount of work to address the key concerns, and we want to share our journey with you. We are due a revisit from Ofsted and the Care Quality Commission very soon, and they will be keen to chat to you, the workforce, about the progress made. The first key concern was safeguarding, specifically the use of part-time timetables, children and young people being removed from school roll, and tracking of vulnerable children housed in the local area by London boroughs. There was a lack of strategic oversight in these areas of concern. To address this key concern, we've implemented weekly Missing Mondays meetings with a single focus on locating and tracking children missing from education. We now collect and analyse secure data from schools on in-year applications, leavers, part-time timetables and 10-day absences. We've improved communication with our special educational needs coordinators in our schools and have used the SENCOs to remind our schools of their responsibilities in relation to off-rolling, exclusions and attendance. An attendance monitoring officer is starting in post shortly, and their role will be to monitor attendance, liaise with children, schools and wider agencies. Key concern too was around the CCG's lack of strategic leadership around SEND reforms. Clinical commissioning groups are clinically led statutory NHS bodies responsible for the planning and commissioning of healthcare services for their local area. Commissioning is about getting the best possible health outcomes for the local population. It involves assessing local needs, deciding priorities and strategies, and then buying services on behalf of the population from providers such as hospitals, clinics, community health bodies, and so on. Since the 2018 inspection, the CCG are now involved at all board meetings and lead areas of the SEND Improvement Programme. There is now a designated clinical officer in post. The CCG representatives on the programme are working on projects like the Quality Assurance Framework. They've commissioned training and are able to now monitor quality. They also offer challenge to other agencies in order to get the best outcomes for children and young people with special educational needs and/or disabilities. Key concern 3 relates to the poor quality of the action plan for the SEND strategy. The strategy is important as this shapes the direction the local authority will take in relation to SEND services. People involved in this work stream have worked with other local areas that had good or outstanding Ofsted reports to help develop an effective strategy for Worcestershire. A lot of the time has been spent ensuring we've heard the voice and opinions of children and young people, their parent carers and health and education professionals. These are the people that will deliver and use the service. So we need to make sure we've listened to them and their needs and their views, then they are reflected in the strategy to help us get the best outcomes. We hope to have the 2021 to 2025 strategy delivered in June this year, and it will include a focus on preparing for adulthood. This is the next step for a young person with SEND once they have completed their school age education. Ofsted identified a lack of joint commissioning arrangements in our local area. Joint commissioning arrangements must cover education, health through the CCG, and social care provision that is reasonably required by local children and young people with SEN and disability. These arrangements should be clear about how this provision is commissioned and who is responsible for its delivery. The strategy for joint commissioning has been reviewed and the new strategy is now being drafted. Key concern 5 relates to the variation in skills and commitment of mainstream schools to provide effective support for children and young people with special needs and/or disabilities. Here we've worked with parent carers to produce guidance for schools in areas such as the graduated response and children with medical difficulties guidance. Through our school inclusion officer, we've started a SENCO network, which brings together the special education needs coordinators of schools in the local area to provide training and advice on best practice. We've also co-produced e-learning modules which have been shared. This training and development of standardised materials means SENCOs feel more supported by the local authority and schools are delivering cohesive advice and support to their children and families. We've had some brilliant feedback from SENCOs, parent carers about the impact of this work. The lack of suitable provision to meet the identified needs of children and young people with SEND was raised as key concern 6. Ofsted said that the overall quality of provision for children and young people who have SEND and/or disabilities in the local area is variable, and not all schools are inclusive and work in ways that are in complete contrast to the spirit of the SEN reforms. So far, we've increased places at 4 special schools, delivering an additional 61 places. Treetop's enhanced mainstream autism base opened in January 2020 with 6 full-time equivalent places, which increased to 20 places by September of the same year. We've co-produced the Medical Education Review and the Mainstream Autism Base Review with education, health and parent carer representatives. The medical education recommendations are going to Cabinet in March 2021 for approval and the reviews are being drafted. Ofsted were concerned that relationships with parents and carers are fragile. Parents and carers are overwhelmingly negative about their experiences and involvement with the local area. Many feel they're not listened to by officers and frequently told inspectors that they had to fight to get the right support for their child. To address this, we have built up strong links with parent carers through our parent carer forum, Families in Partnership representatives. Representatives from FIP are present at all the steering groups and we co-produce improvements where possible. Our advice, documents and content have all been influenced by this co-production from the local offer website through to our review of the education healthcare plans. We've held co-production events and roadshows where parent carers can come and speak to staff and give their views, opinions and feedback on the services we offer to families with SEND. We've also had great success with our parent carers survey, shared with FIP, education settings, health and social care in order to hear the views of parent carers in our communities. The results of this annual survey are analysed and they inform our focus on improvements. We produce a You Said We Did report from the survey, which details which areas of feedback were given from parent carers, what we as a local authority have done to address these. Parent carers and their children and young people are our service users, and it is so important that we listen and respond to their feedback. Key concern 8 revolves around the poor quality of EHC plans, included limited contributions from health and social care and processes to review the quality of the plans. An educational health and care plan is for children and young people aged up to 25 who need more support than is available through the special educational needs support. EHC plans identify educational, health and social needs and set out the additional support to meet those needs. We've recruited a designated clinical officer who acts as a single point of access to health. We've also developed a multi-agency quality assurance framework to ensure all plans are of a high quality and plans will be audited in line with this framework. All SEND casework officers are signed up to NAS and SEND Casework Award BTEC levels 3 and 4 to ensure they're trained to a high standard and can do the best job possible. We've received some brilliant feedback from parent carers, schools, etc. on the work that we've done so far, and we've seen a significant improvement in the timelines of EHCPs, delivering 100% of plans within the 20-week statutory deadline. This key concern is around the lack of systems to track outcomes for children and young people with special educational needs and/or disabilities. Specifically, young people after they reach 16 who are not in education, employment or training or are youth offenders. Over the past 2.5 years, we've developed a SEND data dashboard to analyse, monitor and evaluate key performance indicators around the statutory outcomes for these students. We can see trends in our local area and compare ourselves to national statistics to see how we're performing. We can also use this data to inform our strategy and direction to improve outcomes for children and young people with SEN. Ofsted found there was a disproportionate number of children and young people with SEND who have been permanently excluded from school, and in particular those with special educational needs but no EHC plan. The rates of exclusion were found to be well above the national average and rising sharply at the time of inspection. We have addressed this by providing training on part-time timetables and exclusions to our special education needs coordinators in our schools. This training has increased the understanding in schools around their statutory duties in relation to exclusions. In February 2020, we launched a review of exclusions and alternative provision with the key aim to reduce exclusions in schools and promote inclusive practice. Pupil and parent feedback to this review has demonstrated positive experiences for children attending alternative provision. A local offer gives children and young people with special educational needs or disabilities and their families information about what support services the local authority think will be available in their local area. When Ofsted inspectors visited Worcestershire in March 2018, they found the local offer website was not fit for purpose. Additionally, every local authority must keep a children with disabilities register, and we did not have one. We've worked hard on improving the content and quality of the local offer, and much of the content has been co-produced and aims to be as accessible as possible. We've used our parent carer survey feedback to inform the continuing improvement of the local offer, adding or removing content, including more visuals, videos and links to the services. Of course, there's no point having a good local offer if parent carers, schools, children and young people with SEN don't know about it. So we've worked with partners to promote the local offer, delivered promotional flyers to schools and doctors' surgeries, and even had a local offer roadshow to spread the word far and wide. The impact of this work has been positive feedback from schools, SENCOs, parent carers and support services on the improvements we've made and a significant increase in the use of the website. We've launched our Children with Disabilities Register and are in the process of relaunching a co-produced version shortly. Our final key concern was relating to the academic outcomes, behaviours and attendance of children and young people with SEN. Ofsted noted standards at the end of Key Stage 2 and 4 achieved by children and young people who have SEN and or disabilities in Worcestershire are below those seen nationally. We use our data dashboard mentioned earlier to monitor attendance and can see that attendance is improving since the inspection. Our dashboard has been commended as an example of excellent practice to be shared with other local authorities. We've created a school inclusion forum to consider thematic data and concerns and school inclusion profiles, which are shared with schools to improve focus on outcome for children and young people with SEND. As has been summarised in this video, Worcestershire is working really hard to address the key concerns raised in our 2018 inspection, and we hope this video has given you an overview of the journey so far. If you would like any more information or detail about what was covered, then please email sendimprovement@worcestershire.gov or speak to your line manager. Thank you.